Hello, my name is Mike Ashancer and I'm a therapist and guide in Boulder, Colorado. And today I wanted to talk to you about ADHD. ADHD stands for Attention Deficit and Hyperactivity Disorder. And for those of you that know me, you might know that I've been diagnosed since 8th grade and that I've really been experiencing symptoms since I was 5-6 years old. And it took that long for people really to understand what was going on with me. And that actually created a little bit of confusion and frustration and disconnect between me and my teachers. So when I was diagnosed in 8th grade, it was this great moment of understanding and clarity. I felt some freedom, and it didn't take away my symptoms. It didn't mean that one option for me was I could have taken a pill and that might reduce my symptoms, but my family and I decided not to go that route. So what it meant was that now that I knew what was happening and knew a little bit about how other people have been successful with that, I could start training myself and learning how to sit through situations. So a little bit about ADHD is that you need 6 months of symptoms to be diagnosed. Now there's a whole list of symptoms, and if you go to see a therapist, someone who's hopefully really skilled in assessment, they'll go through that with you and ask. Now there's 3 different types of diagnoses within the ADHD spectrum. There's hyperactivity and impulsiveness, which is one breakdown. There's also the combined breakdown, which is hyperactivity, impulsiveness, and also inattention, which is the 3rd breakdown. So the hyperactive and impulsive way that ADHD manifests is typically in young men, but can also be in young women. And the inattentive way that ADHD manifests is often seen in young women. Now, that's not a fixed rule, but that's just what we've seen happens more often than not. So there's also different scales. There's mild, which is if someone just barely meets the amount of symptoms to be diagnosed with ADHD and isn't really having consequences socially or in school or work. There's moderate, which is the step up. They're starting to have some more consequences and seeing more symptoms. And then there's severe. And severe, they might not actually have many more symptoms, or they might, but it's really about how it's impacting someone in their life, their school, their home, their work. So that's a little bit about how ADHD is diagnosed and the different ways that it can show up. So what does that mean? What's actually happening to your body? So to talk about the brain really quick, when we take scans of the brain, and I'm not a neuroscientist, but what we've found looking at research of people that are, is that their frontal cortex, which is used for reason, memory, inhibition, it actually appears smaller. Whereas the motor cortex, which is in charge of movement and getting people active, is actually larger. So imagine that combination. You're a maybe 15-year-old, 10-year-old boy, young girl, or other, and you really have a lot of brain development for your movement, but not a lot of development for your inhibition. And now you're asked to sit in a classroom, which does not support people to be moving. It can be a really painful and challenging experience, I think, as a lot of you watching this video really know. So the other piece of the brain that I wanted to talk about is norepinephrine and dopamine. Now these are 2 chemicals that are in the brain, and they're responsible for sending messages to areas of attentiveness and also motivation. So now what we're finding in neuroscience is that people with ADHD either have less amounts of those chemicals or they're using those chemicals up faster. So when people take drugs for ADHD, they're designed to stimulate an increase of norepinephrine and dopamine. They also do other things, but relating to the brain, that seems to be the most important part. So what causes ADHD? There's a big movement right now of people talking about the social and cultural causes that, in other countries like France, they have a 0.5 diagnosis rate of young men, whereas in the US we have a 9.5 to 11% diagnosis rate, depending on which source you like. So that's a huge gap. And the French schools are definitely seem to be more supportive of getting people moving and in their bodies than the schools here in the US. So maybe that's one cause, and that's certainly up to opinion. Another piece of research really shows that of people diagnosed with ADHD, 25% of them actually have one or the other parent that also had ADHD. So there is a strong hereditary link. Other symptoms or other causes are related to isolation and stress, and growing up in that environment where there's, not a lot of certainty, and that can actually stimulate confusion for the brain or for the young person, and they can start to experience symptoms of ADHD. Now, attachment theory and some other great theories that are building a lot of traction also say a lot about that. If you're interested in hearing more, I really recommend getting Dr. Gabor Mate's book, Scattered Mind. It's really informative and has a great way of looking at how trauma, stress, and environmental factors can actually influence our experience with ADHD. So that's a little bit about it. I hope this video was informative, and if you'd like to learn more, please follow this link to my website.